This is Health Wealth Safe. We believe everyone is entitled to high-quality, inexpensive healthcare. What started as one doctor's dream to bring the control of healthcare back into the patient's hand has now turned into a partnership of independent physicians across the country, all working hard every single day to make this dream a reality for their patients. Together, we will unlock a healthier world. That's the power of Health Wealth Safe.
The U.S. healthcare system is facing a lot of challenges, especially when it comes to medical waste. There are almost 14 million Americans with 3 or more chronic conditions that require frequent medical attention. As this population continues to grow, how can we best support these individuals in a dignified and cost-effective way? Introducing Health Wealth Safe, a proven healthcare technology company focused on reducing cost while increasing the quality of care for everyone. At Health Wealth Safe, we use our FDA-approved devices through bidirectional communication with our care managers and physicians. Our devices work remotely to passively monitor your activities of daily living. With the Health Wealth Safe app, you are able to keep track of activities such as sleeping, water intake, medication, and so much more. We promote patient health and can also detect early changes in health, such as physiological and non-physiological data, which results in early management of the illness and prevent hospitalization. When a significant change in behaviors is detected, an alert will be generated to our team of highly qualified care managers. The care management team will then reach out to you, and if needed, we will refer patients to their own physician. This also cuts down on medical waste that is created with testing or imaging that you may have already had in the past. Health Wealth Safe wants to help change the way the medical industry works by providing timely, affordable treatment where you can actually see the results. This will lead to a lower overall cost of healthcare and more satisfied patients. Our app not only helps you keep track of activities and medication, but you can also store all of your medical records in one place. We believe that you should be in control of who gets to see your information. If you decide to simply share your information with a loved one or a caregiver, they just have to download the Health Wealth Safe app. You asked for a better way to do healthcare, and we heard you. Let's do healthcare the way it should be done.
I, Subodh Agrawal and Bantwal Baliga, thank you for all of you to join this recorded webinar. Let me tell you about me. I'm a cardiologist, been in Athens for 25 years, and passionate about developing a physician-led healthcare system in the United States. I run a doctor's ACO, And our goal is to improve healthcare by reducing the cost. I have developed a health IT company and I own a Health Well Safe. And we have used this technology to improve the care of the patients from distance while reducing the cost. With me is Dr. Baliga. Dr. Baliga is a board certified endocrinologist. He worked in Columbus and Applica in Alabama. He has served as a director of diabetes program at Mount Sinai School of Medicine in New York. He trained in 3 continents, in India and United Kingdom, as well as in the United States. He's passionate about his patient, especially patients who suffer from complicated diabetes. He will watch them like a hawk. And if you have diabetes and requiring insulin, you want him to on your side. So today, we want to focus on a new technology, which really develop freedom for the patient. It's called using remote patient monitoring while you have a glucose sensor. What is a glucose sensor? This glucose sensor is a continuous glucose monitoring, and we will talk about this today. So what has happened is diabetes continue to grow in size in basically all over the world. And the number of those patients continue to grow, but specialized physicians like endocrinologists like Dr. Baliga are not enough. So not many patients are really getting the blood sugar control and getting great treatment. So we continue to have high morbidity as well as mortality from diabetes. So Dr. Baliga, tell us about what are the advantages of remote diabetes management?
Yes, thank you, Subodh. So that is a very good way to start the webinar. As you see, you being a cardiologist, I'm an endocrinologist, so we help each other in taking care of our neediest patients. So I have 4 offices, one in Columbus, Georgia, one in Opelika, Alabama. Then I have part-time office in LaGrange, Georgia, and Athens, Georgia. So we are down here in the trenches, right? We see exploding number of patients with diabetes. And at the same time, we do not have enough endocrinologists. Now, one of the ways we try to take care of our large number of patients by using a population health management. And the old way of taking care of diabetic patients didn't work, right? So patients will come to your office once in 3 months, 4 months, then they get some adjustment in their medications, including insulin. They come back and they are in the same place where they started. So we know that diabetes is a terrible disease. It is an unforgiving disease. It causes a lot of damage to the body, including death. At the same time, we are in an era where we see a lot of technological advancement in diabetes. And what I realized that regardless of what I do, our patient needs some extra help, especially when they are at home or at their workplace. So the advent of a continuous glucose monitoring system has actually revolutionized diabetes management. So the advantage of using a remote patient monitoring tool using a CGMS is we know the patient's real-time blood sugars and alerts, and patients can keep track of their diets and set healthcare goals that may fit any lifestyle, and they get a quicker response to out-of-range values that allows them to recover very fast. And also using these technologies, we are being more proactive rather than being reactive, because it's not right to wait until something bad happens, right? So that's why we love to talk to our patients, educate them, give them the latest technology that's available. So as they say, knowledge is power. So in the old days, we used to do the glucose monitoring by just doing the finger sticks. Some people do once a day, some people do 10 times a day, but most of them prefer not to do the glucometer finger stick readings because it hurts, right? But now we have the continuous glucose monitoring system, so we can look at the real-time glucose values, then we can look at the patterns, and we can look for hypos and hypers. And now with this digital technology, especially a program like Health Well Safe, we have patients under this Health Well Safe who are enrolled, and we can monitor them much more easily, and patient satisfaction is really great. So how does a CGM work? So when we do the finger stick using a old glucometers, it does the capillary glucose reading. It uses the same enzymatic reaction, the glucose oxidase reaction, to convert the blood sugar into actual numbers. So here with the sensor, you have a transmitter sitting on top of the skin, and there is a needle which enters the subcutaneous tissue. As you know, the subcutaneous tissue is abundant with the interstitial fluid. So the glucose sensor in that needle that interacts with the interstitial fluid and looks at the glucose molecules, and using the glucose oxidase reaction, the data is sent to the transmitter, which beams the results back to patient's smartphone. So now you can see the actual real-time blood sugars on your smartphone. So there are certain pitfalls, like when the blood sugars are steady, if you do a finger stick glucose and if you look at the sensor glucose, they are almost identical. But if you see in this graph, when the blood sugar starts rising very rapidly, then the sensor values may be much lower than the actual blood glucose values. Similarly, from a high, if the blood sugar drops too fast, then you can have sensor readings higher than the actual blood glucose results. So when we look at the continuous glucose monitoring device and we download sensor data in the clinic, or even remotely we can download. So you typically see an overlay of blood sugars over a period of a couple of weeks, about 2 weeks. And the advantage is we can exactly see how the sugars were behaving before the sensor, and the lower panel, you see the blood sugar after the sensor. So just by using a continuous glucose monitoring system, the patients will be able to manage their diabetes better, because now they know what is the blood sugar they wake up with, what is their blood sugar before they eat, what is their blood sugar 2 hours after eating a meal, and the bedtime. So when the patients see their glucose in real time, this is like an educational tool for them. It's like a biological feedback, so that next time when you eat a bad meal, you realize that, oh, my blood sugar jumped to 300 when I ate a particular meal. So this time I'm going to eat a smaller amount. So on the right-hand side panel, you see those green dots. They're like the finger stick glucose. Everything looks fine, right? But if we don't use the sensor technology, you're going to miss all those highs and lows. That's the real advantage of using a glucose monitoring system. So one of the concepts in interpreting your sensor reading, you have to look at certain values. Nowadays, the buzz word is time in range. Now, time in range means the percentage of time a person spends between a blood sugar of 70 milligram at the lower end and 180 milligram at the upper end. And the typical recommendation is it has to be more than 70% of the time. That's called a time in range. The maximum allowed higher blood sugar is about 25% above 180 and not more than 5% above 250. But more importantly, if you look at the red, right, I always tell my patients to concentrate on red. Red means hypoglycemia. We do not want our patients to have hypoglycemia. Why? Because hypoglycemia kills. A little bit of high blood sugar is okay, we can manage it. But very important for patients who are on multiple doses of insulin, especially those who are having a very hectic lifestyle, running around with their kids and school and sports and all. So for them to watch out for hypoglycemia is very important. So we do not want more than 4% of the time blood sugar below 70, and definitely not less than 150, less than 54 at the lower end. So this is a very important concept, and this is the reason why we need to use a CGMS. Now, these are all the ADA recommendations. in a patient with the type 1 or type 2 diabetes, they recommend time in range about 70%, blood sugar of not more than 25% above 180, and not more than 5% of the time about 250. And we talked about the lows again, less than 4%. So, but a older diabetes patient with underlying CKD, congestive heart failure, COPD, so they do not need to be in a tighter control. For them, the values are different. So you can have a time in range of about a little bit more of 50%, then a time above range, say 180 to 250, about 50% and less, and blood sugar more than 250, less than 10% of the time. But we do not want low blood sugar in these patients, not more than 1%. So the focus in older patients with the underlying comorbidities to have their blood sugar slightly relaxed. We recommend A1C of around 7 to 8% because we know that low blood sugar means increased mortality. In pregnancy, again, the same values hold, but in patients with the gestation diabetes, it's much more stricter control. We try to keep their time in range between 63 to 140 as much as we can. So where can we use the continuous glucose monitoring devices? Obviously in patients with diabetes, especially those who are type 1s and even type 2s who are on insulin therapies, sulfonylureas, they are ideal candidates for continuous glucose monitoring. And especially those with brittle diabetes, frequent hypoglycemic episodes, pregnant women. So they all qualify for continuous glucose monitoring. But now there is a lot of movement outside in the community where people are more health conscious. They are a part of the diet program. There is intermittent fasting. So people have started using continuous glucose monitoring devices to help them to manage their weight and exercise. But again, these are all off-label indications. So the CGMS companies, they cannot recommend using these devices as an off-label. But patients on their own, if they want to buy it and use it for example, somebody may want to look at their pre-glucose reading before they start exercising. And if they're going to do a heavy exercise over the next several minutes and hours, then they can keep on looking at their sensor values. And also they can look at their post-exercise levels. So when we download the sensors, here example, we are talking about Dexcom. So we look at something called an ambulatory glucose profile, commonly called as AGP profile. So what do we see here? If you look at it, on the upper corner, you see the average blood sugar of 128. That's very good, right? Then you look at the time in range. Here it's like 90.7%. Then time above range, 6.7% of the time. But if you look at the lows, 2.6% low and very low, about 0.6%. Then you look at the standard deviation, 35. So these are all acceptable figures. Then the middle panel, what you do see, this line is 180 milligrams per deciliter. The lower line is 70 milligrams per deciliter. Then you look at the pattern. For example, this patient is waking up in the morning around 6 o'clock. His blood sugars are very fine. There is a small bump after breakfast. Did very well during lunch. Somewhat higher sugars after dinner. So when I look at the ambulatory glucose profile, I know everything about my patient that needs to be known when you are on an MDI regimen. And this is again one of the downloads on Dexcom. Again, you see the same thing, average blood sugar of 171. Now the GMI is a very important tool for us. GMI is called a glucose monitoring index. It's just like having your hemoglobin A1C value in the last 2 weeks. I like hemoglobin A1C, but it gives me a data over a period of 3 months. But I want to know what's happening with my patients in real time in the last 2 weeks. So this GMI has a much more importance in my practice. Again, here, as you can see, 62% of the time in range, 35% high, 2% very high. So we need to work a little bit harder for this patient to come down into the time in range of about more than 70%. So this is how, as we discussed, we look at the time in range between 70 to 180, typically above 70%. Then this will help you to look at your blood sugars when you went to bed, where you were, when you woke up in the morning, where you are, daytime, eating meals, snacks. So every time when you glance at your smartphone, you will be able to see real-time glucose readings. Then also you get warnings, right, about a high glucose or low glucose. Then you can also look at which part or which time of the day you're more likely to have higher sugars or lower blood sugars. Then you can compare these reports to the previous reports. So I like Health Well Safe because we have this portal where all my patients are listed. Not only that, I get warnings or indications saying that you have some critical values. So all I have to do is click on this patient's chart. For example, this is a gentleman whom I have known for a long time. So I got a critical value. So what happened was he has a history of type 2 diabetes for a long period of time. Is insulin requiring, usually under decent control. He has underlying hypertension, hyperlipidemia, and underlying coronary artery disease. He was on metformin 1000 milligram twice a day, Jardiance 25 milligram once a day, Tresiba 8 units at nighttime, and Humalog on a PRN basis. And he was supposed to be on Ozempic, but because of some financial issues, he hasn't been able to get it. So what happened was he was lost for follow-up for about 3 months because he went somewhere to help his friends. When he came back, I was astonished because now his A1C has risen to 11.4%. And on arrival, his blood sugar was 265. He was very apologetic. He said, sorry, I messed up, but I'm going to behave better. So we reinforced everything. We put him on a sensor, continuous glucose sensor at the same time. And within the next 7-8 days, he did very well. Now you see almost 100% of the time, he came into the range and more, right? So this is the advantage of using a continuous glucose monitoring system, because in the old days, patients sort of promised you that they're going to behave better, but once they leave your office, they become busy, they do not take good care of their diabetes. Now, if a person is wearing a CGM, and if the person knows that I'm going to watch it remotely, they automatically behave better. So this is one of the advantages of remote patient monitoring using a CGM. So these are all his medications. He did very well after that. Then, so you can see all the numbers throughout the day and night over a period of few days. The second case, This is another very interesting case. And this shows you the power of CGM and remote patient monitoring, regardless of where the patient is. So sometime in July, Dr. Agarwal calls me, and he was very disturbed because one of his closest relatives, who is in India, who happens to be a very busy primary care doctor running a very successful clinic, he was visiting New York for some family wedding or something. And Dr. Agarwal was very concerned. His blood sugars were in 400 and 500 range. So Dr. Agarwal, he flew to New York with a Dexcom sensor in his bag, and he went there. Then we started talking to the patient, this particular doctor, and we changed his therapies. We put him on Dexcom sensor. Then we started monitoring him remotely from here. And this is the first 2 weeks of a download. From an average blood sugar of 300 and 400, he had already come down to an average blood sugar of 171. His GMI had come down to 7.4%, 62% time in range. And as you can see the pattern, one of the most satisfying things for me when I look at that, you don't see big mountains following a meal. Because if you see much higher blood sugars before or soon after a meal, then we know that he's eating too many carbohydrates. But this gentleman, to his credit, he took literally whatever advice we gave him. He manipulated his diet. He started exercising, reduced all his carbohydrates and avoided sugar, took all his medications, including mealtime insulin. And we put him on Humalog 3 times a day. We started him on Ribulsus. We started him on Tresiba, and he was already on Jardiance and Metformin from India. And look at the panel on the right side. That was the latest one we have for you from August. Now, the average blood sugar is 134. 97% of the time, he's within range. Remember, this gentleman is in India, and we are here, me and Dr. Agarwal, helping him through the Health Well Safe, doing the remote patient monitoring, talking to him very frequently. See, this is what I'm trying to tell. We have all these exciting technologies and remote patient monitoring tool. The idea is to get all these technologies to our patients. They really, really need this technology, because when I look at my patient population with the uncontrolled diabetes, I know that technology is going to save my patients. So this is an example of how a busy doctor living in India can be managed from here using these Dexcom sensors and remote patient monitoring tools such as Health Well Safe. So as you can see, time in range from 62% in July to 97% in August. So we are going to show you one of the ways how I use Health Well Safe monitoring tool to do the video call with my patients. And please have a look. All right. How are you, sir? You're doing okay?
Yes, sir. I'm doing well. How are you?
So we are doing some telemedicine visit through this Health Well Safe app. You ready?
Yes, sir. I'm ready.
All right. Okay. So give me a full name.
John Smith.
John Smith. Okay. Hey, John, how long you been diabetic now?
For about 17 years.
Okay, very good. Okay. How are you doing? You're doing good?
Doing pretty good. Little fluctuations here and there, but not too bad.
Okay. So I believe you're on Dexcom G6 and you're on insulin pump also, right?
Yes, sir. The Dexcom G6 and the Omnipod Dash.
Omnipod Dash. Okay, good. So did you have any very low blood sugars recently?
Around 57, 58.
Okay, nothing needing hospitalization or anything. That's good.
No, sir. I haven't had any of those.
Very nice, very nice. And you have any complications of diabetes, such as damage to the eyes, retinopathy?
No, sir. Had my eyes checked.
Never had any laser treatment?
No, sir.
Okay. Any kidney damage?
No, sir.
No chronic kidney disease. Fantastic. Okay. Any problem with your feet? Neuropathy?
No, sir.
Foot
Fortunately,
ulcers? Nothing. Very good. You're doing very well. Fine. Any history of any heart attacks and strokes?
no, sir.
Any problem with your thyroid gland?
Hashimoto's.
Hashimoto's. Okay. Yes, I'm looking at your data, the Dexcom G6 for the last 2 weeks. Looks like you're doing pretty good. And a couple of things I want to discuss with you. What I see is your average blood sugar is 124, which is excellent. Then you have a few lows, not that many. It says less than 70 milligram, only about 3% of the time. Less than 54, almost none. That's good. I don't want you to have low blood sugars. Your time in range, which is very good. You're like 88% of the time you are within normal range. That means you're doing very, very good. And only about 8% of the time your blood sugars are high. So these are all very good numbers. That tells me that whatever therapy you're on and or whatever lifestyle modification you have done is working very well. And I believe your hemoglobin A1C is 6.3%, which is excellent. And what I see in your graph over the last 2 weeks, you tend to have somewhat higher blood sugars beginning, say, 10 p.m. to, say, 2 a.m. So that usually indicates that you're eating a snack at that time. Is that true?
Yeah, sir. I get up about 4 a.m. and go to the gym. So about 10 or
right.
11, I'm having a snack.
Yes, that's why. So from 4 to 6, 7 o'clock, your sugars are doing so good. But the good thing is, even while you're doing exercise, your sugars are not dropping too low. That's excellent. You have a slight bump around the noon lunchtime. Not too bad. I think the highest you go is like 180 or something. That's within a reasonable limit, because what we recommend is fasting sugar between 80 to 120, 2 hours after eating, not more than 180, which you're doing. So what we'll do is, I think the pump settings that you have is reasonably good. I don't need to change anything. We'll continue the current carb ratio and the basal rate. The only thing I recommend is nighttime when you eat a snack, look at your Dexcom and see where you are. Okay, if your sugars are already high, then go ahead and give a correction bolus.
Okay, I can do that.
Yes, and if you either you can do that, or you can give at least 1 or 2 units just to bring that peak level down.
Okay.
So yeah, it's excellent. Okay, and I believe you take thyroid medication also, right?
Yes, sir. The Synthroid every morning.
Yes, you take 88. That's good.
Yeah.
And you're on a blood pressure medication. You're on a cholesterol medication. Yeah, I think you're very well covered. I'm really happy for you.
Well, thank you. It takes a lot of hard work and
Yes. Yes.
great
Do you like your Dexcom?
Yes, sir. I do. It really allows me to, for the lifestyle that I want to lead with the, exercising and playing golf, spending time with my kids and my wife. It really, gives me the opportunity to do that.
Yes. And make sure that you look at the app all the time. Even if you're not doing anything, just glance at it,
Okay.
And watch the arrow. Arrow is very important. If the arrow is pointing up or horizontal or lower down, be careful if it's showing straight to low. That means your sugars are dropping very rapidly. So that's the time you have to be dropping everything and take care of your blood sugar. Eat something. Make sure that you don't drop too much. Do you have a glucagon kit at home?
No, sir, I don't.
Okay, so we will call in a glucagon kit. There's something called G-Vogue, which is a pre-filled glucagon pen. You should have it all the time. It's like a rescue pen in case if you're hunting or on a cruise boat somewhere or flying, if you get, or you're stuck in a traffic jam, and if the sugar drops too low, and this will quickly bring up your sugar. Okay,
that'd be great.
Yes, everything is fine. We'll take care of your refills and everything. Do you need anything else from me today?
No, sir. I think I'm good on that. When do I come back in?
So we will, our front desk people will call you to schedule another appointment in 3 months. Okay.
Okay.
I want to look at your CBC, chemistry panel, lipid panel. Then we do a free T4 TSH and a TPO antibody. I want to look at your urine microalbumin.
Okay.
Good. I'm so proud of you. Keep up the good work.
All right. Thank you for all your help, Dr. Baliga. I really
right.
appreciate it.
All right. So, see, that's the advantage of this whole system, right? Because at the moment, our way of providing care to the patients is very fragmented. So imagine the system where you have this Health Well Safe app on your phone. Regardless of where you are, you can do a telemedicine visit with your patient using the video conferencing. Then at the same time, because now Dexcom has been integrated into the Health Well Safe app, then we can see the numbers about the continuous glucose monitoring system. And we know what medications the patients are on. So this is a win-win situation for everybody, because when I make a call to the patient, I don't have to look around too many places. In one place, we got everything. So this is the future of medicine. I wish more and more of us are going to use these technologies. So just wanted to thank you, the Southeast Diabetes Corporation, for helping us with this seminar or webinar. So that brings us to a little bit more things about Dexcom, because we got several different sensors. We got the Freestyle Libre 2s, we got the Dexcom G6, we got Guardian Connect, we got Senseonics. But for today's webinar purpose, we'll just focus on Dexcom. So with the Dexcom G6, you have a real-time glucose readings every 5 minutes, and you have to change the sensor every 10 days. It will help you to look at your trends and patterns, and it will give you warnings if the blood sugar goes too high or too low, and no finger sticks are needed to make an insulin dose adjustment. So there are certain expectations, because this is one of the time people call us saying that, oh, I did a finger stick glucose is different than your my sensor. In both instances, they are true readings, right? Because there are two different body fluids. Dexcom G6 looks at the blood sugar in the interstitial fluid, and the glucometer, the traditional glucometer, looks at the capillary glucose. So the readings can be different, but still be considered accurate. So this is the app, the Dexcom G6 Clarity app. Then you have this applicator with the built-in sensor, and every 10 days you change it. This is the actual sensor and the transmitter. You have to change the transmitter every 3 months. So once you start wearing the new Dexcom G6, you have to wait 2 hours to get your first reading. And also make sure that the phone app is within 20 feet of the transmitter, so that you can get the real-time glucose information. Then I always tell my patients to look at the arrow. The trend arrow is very important. Watch out. Here it's pointing to the right. That means your blood sugar is 110, but you're likely to remain around 110, at least for the next 30 minutes. And also you can look at the patterns for the last 8 hours or so. You can look at the current glucose. And there is a Dexcom share button, there is the alert status. Now, we talk about the arrows because this is very important for our patients so that they can manage their diabetes better. So as I mentioned, if the arrow is pointing to the right, that means the blood sugars are constant for the next at least 30 minutes. If the arrow is up pointing in a slanted way, that means sugars are slowly rising, 30 to 60 milligrams per deciliter in the next 30 minutes. If it is a straight up arrow, that means 60 to 90 milligrams up over the next 30 minutes. If it's rapidly rising, you will see 2 arrows. Then you have to be careful. Then you have to take a correction bolus. Then look at the slowly falling, again 30 to 60 milligram. But if it's a straight arrow down, that means sugars are dropping anywhere from 60 to 90 milligram in the next 30 minutes. But if you see 2 arrows, be very careful because sugars are dropping like a stone. That's the time you stop everything and drink a glucose drink or eat something. Then the sensor gives you urgent low alarm. That's very important. This cannot be turned off in your app. This is a constant feature. That's the safety feature. There's another thing called the urgent low soon alert. That means your sugar is going to drop below 55 within the next 20 minutes. Since we have some time, if you're too tired of alerts, maybe these things can be set off, but I recommend that you keep it on. Then you get a high glucose alert and low glucose alert, which is very important. Then again, when you look at the numbers, then you can make a treatment decision. In the old days, when the sensors initially came, they were there, but we were told to do the fingerstick glucose before you make adjustment to your insulin therapy. But nowadays they are so accurate, you can use readings from your Dexcom to do the actual dosing of your insulin. But if your symptoms don't match your sensor readings, always do fingers to verify. Now, a couple of things, with the travel, use walk-in metal detectors or be hand-wanded. Don't use these full body scanners because that can interfere with the readings. Do not put the components through baggage which go through the X-ray machine. Then if you are going to have an MRI or a CT scan or diathermy, the sensor needs to be taken off. So Dexcom share option is one of the best things with the Dexcom. Remember, I talked about the person who is in India, the doctor. So I followed him using the Dexcom share so that I could see his numbers in real time. And it worked very well. So so what I plan to do is use a Dexcom share for my neediest patients until they become safer, then they can do the usual Dexcom monitoring. How to handle emergency situations, as this Healthwell Safe is a remote patient monitoring tool. So if you have a real emergency, you have to call 911. So this is for non-emergency management. So we monitor, the Healthwell Safe has a great call center. They monitor all the numbers, and there are certain guidelines. When they hit that number, if there's a critical value, I get a notification. Then either I will call you back or my office will call you back. And we also want to make sure that you get your glucagon kit. So anytime patients are on insulin therapy, they must have a glucagon kit at their disposal at any time. So, Dr. Agrawal, would you mind stepping in and talk to us?
This is an awesome description of the technology. So let me recall one thing, what I learned from today, that if you want to stay free of diabetic complication, like your patient John Smith, for 17 years and no complication, you need to take the ownership of your disease self. You need to learn. So what you're telling me, if I'm a patient, I need to learn how to read ambulatory glucose panel. So I can see what we eat, how it affects my glucose. If I'm stressed out, how it affects the glucose. If I don't do exercise or do exercise, how it affects your glucose. So this partnership between Dexcom and Healthwell Safe has opened a way that we can basically manage complicated diabetes around the world. Even in astronaut on the moon, we can tell them how much insulin to take, what to do. It's amazing relationship, partnership, is a partnership for a common good. So what it costs, if you're a patient of Dr. Baliga, the cost of the app, Healthwell Safe, is included in the remote patient monitoring and telemedicine. So if you do telemedicine, you do remote patient monitoring, it's basically software is totally free for you and for the physician. Now, if you live outside Alabama or Georgia, you will still get benefit of remote patient monitoring and Dr. Baliga's knowledge, but then you basically see the value of it, and we give you free app for three months, and then we charge you $20 per month. So that means a person in India can use this technology with Dexcom sensor and our remote patient monitoring and get the value from knowledge of endocrinologist and care manager, but very minimum money of $20 per month. Our goal here is to contain the disease create the awareness and prevent complication to occur. The diabetes is a complicated disease, and the cost of maintenance, cost of caring for diabetes continue to rise. And you saw the earlier conversation we had last month. Dr. Baliga gave a great talk, and it showed that the whole world is really everywhere. The disease going to go in next 20 years, next decade, almost 30 to 40% higher. So we basically don't bind you to contract. The minute you say you don't want service, we'll stop it. So our goal here is for common good, and relationship with Dexcom and Health Well Safe is really a goal towards common good, eliminating disease. The sensor itself can change your behavior. It can change you how you eat, how you sleep, how you play, how you laugh, and it's amazing. So we recommend that learn a little bit more about it, and you can go to our website, and Dr. Baliga is available on the internet, his website, and if you don't want Dr. Baliga, you can go to your endocrinologist anywhere you want to, and then we can help each other and do the common good everywhere in the world. Is that right, Dr. Baliga?
That's right, exactly.
You won't
So,
bill them. It's right for
yeah.
your advice. You
Yes.
just do common good. Thank
It
you, Dr.
doesn't-
Baliga.
yeah,
And
it
the other
doesn't
question
matter.
I had was that there's multiple sensors, right? How many different sensors we have for continuous glucose monitoring? Can you
We
put a little bit
use,
light on it?
Freestyle Libre 2, now 3. Then Guardian Connect is from Medtronics. Then we have Sensionics, which is the world's only implantable sensor now.
Remember, Dr. Baliga, you're the first man who implanted the 6-month sensor in a patient. So this is a Sensionic sensor for 6 months. So we basically thank all of you to join this meeting. If you have any question, please address to info@healthwellsafe.com. And we're looking forward to continue going that direction. And we will come more webinar, and please spread the word. And this webinar will be available on the YouTube.
And also, Subodh, before we conclude, could you mention about that patient assistance program if they cannot afford?
I like that very much. I had a young patient who go to UGA as a student, has a brittle type 1 diabetes, and his insurance, and he couldn't afford the Dexcom. Was really very, very figuring out how I'm going to get him. So I went to search, and they have a patient assistance program. Dexcom has a patient assistance program where they give you free sensors. So in order to qualify that, you got to be type 1 diabetes, you got to be in United States, living in the United States, and you need to be on insulin. And then you can go to website and apply for it. So Dexcom doing good, common good for you. And if you can afford it, there is way to get the Dexcom for you. So thank you once again. Thank you, Dr. Baliga, for your time. I know you're very busy, and you're spreading the word. I know why you're doing that. You want to make the world safer, better, diabetic, complication-free. Thank you, Dr. Baliga.
Thank you, Subodh.
Thank you for joining our webinar. Be sure to follow us at Health Well Safe on all social media platforms.